Today I will tell you some very, very important things about what doctors really think, what doctors say, and what doctors do. 15 points that you absolutely must know if you want to get the highest possible quality of medical care. You probably won't find these things in many places because this is, as they say, the plain truth. This is what doctors will never tell you, but what is actually true. This is what you absolutely need to know if you want to stay healthy, if you want to know how to communicate properly with doctors, if you want to receive proper qualified medical care, if you want to avoid being deceived or misled, and if you don't want to take offense at anyone when there's no reason for it. Watch these 15 points until the end. They will be incredibly useful. Many of these are things that nobody likes to talk about. Our spaceships are traversing the universe's vastness. We're higher, faster, and stronger than everyone. Everyone is doing well and everything is wonderful. We have an abundance of everything, including the world's best healthcare. Let's be objective. We have good healthcare. Its level is good. The doctors are good, but it's never perfect. There are always hidden pitfalls, which I will tell you about today. Firstly, you are treated with what is available, not what you actually need. Really, that's how it is. In many hospitals, when you are admitted, this isn't just about Moscow or the provinces. Don't think that treatment in Moscow is proper while in the provinces they use plantain leaves. This can occur in any institution due to the occasional unavailability of previously accessible medication. The doctor faces a choice. You have some condition, you need treatment, but they don't have this medication for you, so they can't prescribe it. The doctor tells you to buy the medication as they don't have it. The second option is that he won't tell you. He'll prescribe you something else, something worse or nothing at all. And this medication just drops out of the system and you'll take longer to recover. It'll take longer for you to get back to normal. Why will he never tell you about this? Because it's punishable. How is that possible? There's something missing in the hospital? Or imagine you'll seem like an unreasonable patient who says, yeah, the doctor extortionist asked me to buy it. Do you know how many cases like this there are when a doctor actually approached because he really cares about the patient and asked the patient to buy some antibiotic for himself, which let's say he prescribed? A culture test, for example, the urine culture results came back, and in the urine culture it says that there is sensitivity only to this one antibiotic, but in the hospital they don't have this particular antibiotic, they have 7 others. They will give him something that doesn't align with the culture test. But will it work? Because it might not be suitable, since the process of ordering and getting the antibiotic into the hospital is actually quite complicated, let's put it that way. That's why it's really important to understand this point, and it's also very important to keep in mind and establish a good relationship with the doctor, letting him know that you're on his side and he's on your side. To find out the real truth, to say, oh, doc, is everything really available there? Or do I need to buy something myself? Like, I understand everything, I really do. I have no questions, no complaints, I won't write anything against you. You'll recover faster, avoid unnecessary antibiotics, and receive the correct medicine, assess it to effectively treat your condition. Establish open communication with your doctor and discuss your genuine needs and what might be unnecessary. Second, this question was brought up right away. Should you buy something? I know a lot of stories where people say that for a certain operation you need some expensive consumables and they come with such wild stories. What's there? For an operation where basically all you need is a scalpel and some sutures, nothing else, they say you need some kind of disposable sensor or some kind of special laser. No, some doctors are truly on your side and can inform you, for instance, about the unavailability of certain medications. Some doctors are charlatans. Scammers exist in every profession, even the most noble ones. There are charlatans, fraudsters, crooks, and scoundrels everywhere. They are not my colleagues, which is why I can speak so harshly about them. To me, they are scoundrels, and scoundrels have no profession. So please, if someone tells you that you need to buy some super expensive consumable, always remember that this really can happen. It's possible that there may not be enough material for a complete show due to something running out. But there is a percentage, and unfortunately, the farther you go from the center to the periphery, as they say, the higher it gets. That people are trying to make money off you because they can't just extort money from you, but they can ask you for money through such tricks and deception. So, friends, remember clearly that sometimes a request to buy something is really about caring for you, and sometimes a request to buy something is just a kind of scam. So it's not black and white. You need to understand this clearly and always try to figure out the situation. Don't file a complaint against the doctor for trying to help you, as it may be an overreaction. Tomorrow, when another patient is suffering, lying there in pain, he won't help them because he'll remember you, who you are. I can give a personal example. During a conference, I went to the clinic and saw a female patient. The patient came in and said, I treated my son in one facility 8 years ago, and since then some complication developed. He ended up with a mass. Where the surgery was done, I went there and they turned us away. Then I went somewhere else and they turned us away there too. And she describes it as what she calls medical ping pong. I explain, listen, I say, well, you go to the federal centers. And unfortunately, in the federal centers, what you want can't be obtained for free. You have to go by your place of residence, but you don't want to go by your place of residence. So what do I end up doing? I say, let's do it this way. I won't write in the papers what you actually have, because otherwise nothing will work out. But I'll take the boy to the next room right now and do it. This was in 2015. I took him into the ultrasound room, punctured the formation and drained it. The boy lost 25 kilograms. He couldn't straighten up due to the formation pressing hard on his pancreas, and he constantly had a temperature of 37.5 to 38 degrees. As a result, I take the boy out of the office. He straightened up. He's fine. He sat down. He tells his mom that he feels great, the best he has in a long time, and thanks the doctor. And I sit and say, it's just that doctors are afraid to meet you halfway, because I say people are different. Sometimes you do someone a good deed. But I say I drained it. Maybe I didn't drain everything. Come, I say, on Saturday I work at a private clinic and I'll do an ultrasound for you for free. And if needed, I'll drain more. And thank God there was a nurse there, so I said that it's free, you don't need to pay anything. After saying goodbye and shaking hands, I received a call 20 minutes later asking what I had done there, to my surprise. Yes, there's someone standing by the deputy director's office yelling, saying that you're luring people into a private clinic. So can you imagine, I caught her there, I come up and say, how can you not be ashamed? I'm the only person who hasn't turned his back on you all these years, the only one, and you stabbed me in the back. What do you think she did in response? Here's what she told me. She said, at least I got what I wanted. Today they're going to admit me. So they admitted the boy, didn't do anything, because they said he was stabilized, everything was done right, good job, but it all happened through a scandal. That's how it goes sometimes. I told her, it's because of people like you who repay good with evil. Next time, I'll carefully consider whether to help or not. These situations and the first 2 points are crucial. A doctor can be good or bad, regardless of your perception. That's the lesson from this story. So use your head.
Is there any indicator, some way to tell when you really need to pay extra for something there? Or is it not necessary? Any advice on that?
Kharkiv is very costly. It's unlikely anyone will attempt to purchase from or request anything of you there when you have hundreds or thousands of acquaintances. For oncological surgery, we have everything needed. We work in a federal center with all necessary resources. We have everything, but it's extremely rare that we need some kind of consumable material. If the surgery requires it, refer the patient to a facility where it's available and can be performed.
Stories claiming that certain complex surgeries are only performed at a specific clinic in a particular location in the Czech Republic are... How realistic is that?
Stories like that? Not realistic. Sasha? Not realistic. 99.9% of the surgeries that exist today are in the guidelines. I don't know, I have a book. Here are the clinical guidelines. For example, they're not very up to date. These come out every year. Well, every year they are released and translated into Russian. Here's the list of authors. The algorithms we use were not invented by us. They are based on statistics from thousands of institutions, thousands that are updated every year. And it says there how and everyone treats this way. When someone says they refuse to operate on a dying patient before, but will save them now, they are like spiders sucking the last money from their victims. Ultimately, it's pointless. That's why I strongly oppose such stories. Let's raise funds. They claim it's the final opportunity, but it likely won't end well. It's just that a person will spend the last months of their life not with their loved ones, not with their family, but will drive their family into debt and die on a hospital bed far from home. They'll need to collect money again just to bring the coffin back. There are plenty of stories like that.
There's a question that worries many people. Is it true that doctors prescribe medications for which manufacturers pay them some kind of percentage and that there are some contracts involved? Of course.
There are even doctors who say, buy it here, here's a link, here's a discount coupon, or buy it at this pharmacy. And it's not just some cheap medicines, it's also expensive medicines. There was a scandal recently, Sasha, about expensive oncology drugs for the treatment of cancer, which people were buying at the pharmacy or somewhere online. I don't remember, and when they checked them by quick response code or the honest sign, I don't remember what it's called. In general, it turned out that these drugs were supposed to be administered or used in some government institution. According to the paperwork, the items had already been prescribed and received by someone else. The question is, someone was given an intravenous with water, and this showed up somewhere. So there was this story, it was discussed in the media that yes, even in the public sector, things like this happen. There are bad people everywhere. There are bad people everywhere, absolutely.
How can you tell if a doctor is really recommending what you need and not just something because of some contract somewhere?
For example, I produce my own dietary supplements, but I never recommend them. That's what I had during a consultation. They won't let me lie. I almost never say, this is Ipsum, this is Ipsum, this is Ipsum. Although I know, and people tell me, why don't you recommend them? Aren't yours cool? Well, somehow I just don't want it to feel like that, you know? I don't do that anyway, and sometimes people attribute things to me, some not so bright characters from the blogosphere, but I don't even recommend my own vitamins, just to avoid exactly these kinds of things. And that's why when someone comes to me and is going to treat a serious illness, if you recommend a specific pharmacy for someone to immediately buy an expensive medication, it will raise questions. I think that the doctor shouldn't. Or sometimes it happens to me, I know that this medication is impossible to find. Well, it's difficult because it's not supplied there and there are some other problems with it. I say, you look for it yourself so you don't think that we have some kind of situation here. I can give you a contact where you can try it yourself. And if he really can't find it himself, he tries, then I can give him a hint, but otherwise no. They'll never tell you, I don't know how. Why? What do you think? First of all, a doctor is a person with a God complex, very often. Picture yourself approaching him as he sits there like a distinguished professor. He then says, sorry, I don't know what's wrong with you, or sorry, I don't perform these procedures. How could he say that? He wants to keep the patient institutionalized, so what will he propose? Either he'll say that only open surgery is absolutely necessary here. He'll try to convince you that laparoscopic kidney resection is nonsense, that it's impossible to remove the tumor through these 3 punctures, that all of this is just nonsense, that you need to use a scalpel, do it the old-fashioned way. If you want it done right, use a scalpel. All these stories are just rubbish. Remember, if somewhere in one place they tell you that you came for a specific operation, that's how it's supposed to be everywhere. You need to understand that you can always come across a specialist who won't tell you the truth and will try in every possible way to keep you in the facility. I don't know why. That's why sometimes if you're facing a difficult or serious surgery, get a second opinion. It will never hurt. Point 4, you will be offered not the best option, but what is available. I'll give an example with prostate cancer treatment. When a young patient comes to me, I offer one type of treatment. When an 80-year-old patient comes to me, I offer a different type of treatment. At times, we simply prescribe medications without any treatment. So the approach is individual because there is no gold standard. There is an ideal treatment method specifically suited for you. And imagine, you brought your grandfather to me who is 70 years old, who has a bad heart, who has aching joints, and who has a sick liver. Naturally, I say, listen, well, here everything has its pros and cons. For him, the best prostate cancer treatment is brachytherapy, implanting radioactive seeds through punctures under local anesthesia. The next day, he will leave us already healthy. He says, but listen, this often happens to me. He says he was at a facility where they told him only removal is possible. I asked him where that facility was. What do they call it there? I say, why don't you ask what treatment methods are available at that facility? They start listing that there's only surgery there and that's it. I say, do you understand? You came to me. We have radiation therapy, we have drug therapy, we have surgery, open and laparoscopic, and I don't just choose what I have. There's a wonderful proverb. When you have a hammer in your hand, everything looks like a nail. I don't just choose what I want. So, if I have just one tool, I want to operate on everyone with it and claim that only this works and everything else doesn't. I see that one patient needs radiation therapy, another brachytherapy, one should not be treated, another requires medication, and the last needs either laparoscopic or open surgery. I choose what fits best. With only one method, it's the same old principle. I can't, it won't work. A better method may exist, but if I suggest it, you might go elsewhere. That's why getting a second opinion is crucial. It's crucial to note that there's a wealth of information available, including a publicly accessible standard treatment from the Ministry of Health. You can see for yourself how they recommend treating this disease. What methods? When you come prepared to the appointment, ask, why didn't you suggest this method or that one? Is it available? The most important question.
For example, the viewer has a choice. Do they want to go see a urologist for an appointment? there are two clinics. So the choice is that there is Dr. Geonov's clinic, which is small, of course, and specializes only in urology. And the other is a large network clinic where there are many, many, many urologists. Where is it more likely that he will be treated better? In the big clinic, where there is a lot of everything and everything is in one building, or in the small private clinic? But as for one, doctor,
When I started my surgical career, began my medical practice, and was getting my medical education. Sorry, it's already been more than 20 years since I came into medicine. I entered medical university in 2002. And back then, especially in our country, it was considered that if you were a top specialist, you worked in a government institution, and if you didn't succeed as a specialist, you went to a private clinic. Private clinics perform circumcisions, varicocele surgeries, and minor operations, while government facilities handle only complicated cases. Now it's different. Now there's very tight competition, and there are a lot of top-notch institutions. And now they're competing for patients, and now there are good specialists both here and there, and there's funding both here and there, and now the government and private clinics are on par. You know, they're really like that, right? So those times are gone. It's no longer like only state clinics are cool and private ones are bad. Not always. There are some really good institutions. Doctors, just like traffic cops, have a quota, so-called sticks. And it's very important to understand this, because sometimes when you go to the doctor, I'll give you a simple example, a cyst. I consulted a patient 3 days ago, and he told me that they offered him, naming a private clinic, they offered him surgery for a small cyst, saying it needs to be removed laparoscopically. And he said this phrase, anyone will tell you that there are no options to keep it or leave it unchanged. He shows me the images, I look at the description, I think, what is there to operate on? There's nothing to operate on here. You send me the disc, I'll look at the disc, maybe there's something else on the disc. He sends me the disc, I look at the disc. What is this? Where is it? Where? There are absolutely no indications for surgery at all. I mean, I look, it's an ordinary type 1 cyst. You don't need to do anything. That means they might want to operate on you because they want to make money, because they want to practice on you, because the surgeon is young. There are 3 quotas, especially in state institutions, for these kinds of surgeries, and you really have to meet the quota for the year. Just try not to do even one. I often see, especially in institutions with patient issues, that it's best to have surgery in reputable institutions with a high patient volume. To meet quotas, they may perform unnecessary surgeries, like operating on a non-existent appendicitis. Well, a rough example is a cyst that, in principle, you could live with for another 50 years and it wouldn't cause any problems. And so, in the end, you are exposed to the risks of anesthesia and surgical complications. In private clinics, this is some kind of financial plan, so they aim to have as many tests done as possible, as many people as possible go through procedures. In state clinics, it's about the number of certain types of surgeries. They have that too, unfortunately. They may provide unnecessary treatment for conditions that don't require it. Unfortunately, we've gotten used to thinking that the doctor is always the final authority. Tarasik, if the doctor said you have something, it means he's sure. And unfortunately, sometimes they end up treating something completely different. They miss something, they don't pay attention to certain things. So always keep this in mind, that unfortunately, if the treatment isn't helping you, sometimes you need to change horses midstream. Everyone needs a second opinion sometimes, and that's normal even for me. Every doctor can make mistakes, everyone. The more experienced the specialist, the less often they make mistakes, but absolutely everyone makes mistakes. And sometimes if you see that there is no effect from the treatment, and even if the specialist is super experienced, you might end up leaving them. The simplest lesson in a clinic will help you in some way.
There are often stories where guys go to urology, and in most cases they find something, and then they prescribe antibiotics, give intravenous drips, and there is some indicator for when to get these drips and when it's really necessary. Well, go to a few more places and double check.
My website has funny reviews about doctors. One person was treated for a decade before coming to me, and I cured them. That happens, but still, it's with a large number of patients. Usually, a doctor should be able to handle things pretty easily, but there are difficult patients, there are complex patients, not simple ones, who really need a special approach and some special knowledge. It is precisely by dealing with these small numbers of patients that top-notch specialists differ from regular specialists. That's why protocols are very important. There are all these guidelines. You can look at them yourself if you want. Several places offered a standard treatment that adheres to protocols, but one place suggested a different approach. Because a doctor, possibly number 7 or 5, is acting independently. Trust me, it's best to follow standard treatment protocols. Everything is available now, so get treated according to the standard. That's my advice.
How can you even understand? I've never heard this before. I've been to various doctors and appointments, but it's not clear which ones follow proper standards. How can you tell?
Starting this year, doctors are required to work according to the Ministry of Health standard. You don't have the right to treat a patient not according to the standard. And if you treat not according to the Ministry of Health's standard, you are basically breaking the law. All medications are different, and whoever tells you that all medications are the same, they're all different. A simple example that you have often encountered in your life. When you travel abroad, you buy a medication from the same foreign company that sells this medication on our market in Russia. There, this painkiller works better. Why? Because the quality of the raw materials, the production, the technology, that's everything. Unfortunately, they allow different standards for the domestic market and for the foreign market. Besides the company that produces this medication, there are also generics, which are similar alternatives, or our analogs. Unfortunately, we have to tell it like it is. Sometimes our medications are better, sometimes they're worse. While some may claim everything is the same, that's not entirely accurate. Medications can differ, sometimes positively, other times negatively. Read reviews for each medication to determine if it works or not. Reviews matter when making a purchase decision. So this is the best test. Don't just take someone's word for it. I often discharge patients for whom I perform rather large, complex surgeries. For example, recently I performed a laparoscopic cystoprostate physiceulectomy. Based on the stage, I determined that chemotherapy was necessary. The guideline determined why I made that determination. It's written in the book. I gather a board at the institution, write that it's necessary, and that's it. I send them with full confidence that the person will receive chemotherapy. And often people are refused at the local level. It happens, yes, they really do get refused. I'm not saying that in Moscow, thank God, things are strict with this, but in the provinces, someone was sent somewhere. They claim hormonal drugs and radiation therapy are unnecessary. I request documentation to support this. There's nothing. This is a very important rule, and it applies absolutely everywhere. Always, if you are denied any kind of medical help, whether it's surgery, hospitalization, or something else, you shouldn't just take their word for it when they say, we won't admit you, or something like that. If the issue smells like a scandal, or if it's about getting a life-saving medication, and they're trying to refuse you verbally, please make sure to get a written refusal. In around half of cases, when requesting a written refusal, they are unable to provide it and must give you the medication. What are some typical situations like this? You gave a complicated example. Give a simple one. There are medications, but not enough for everyone. There are their own patients and there are others. They only give the medication to their own, and who are considered their own. I don't know, maybe some privileged ones, apparently, the ones who thank them. There are different kinds of doctors. There are all kinds. And here's a simple example. We're not making this up. They cured one person there not so long ago. When we do brachytherapy, we prescribed and recommended hormonal medications to the patient. I see they're not working. He says, did they give you an injection? Yes, he says, right here in the stomach, the injection, just like they were supposed to. But in the end, we did the tests, checked, and saw that the medication actually wasn't given. It turned out that maybe he got this medication somewhere else. He sold it to uninsured people without medical policy for personal gain.
And where are the injections?
At the clinic. We already pressured that comrade there.
The professors of treatment with their methods in the clinic didn't really give the right shot to their own colleague.
I don't know what they injected. It feels like it was just saline solution. That happens too. These are rare cases. These cases are rare, but we always give them attention. And with such doctors, we always see things through to the end. That's rule number 10. Both the staff of the institution, the head of the institution, and even the patient are interested during a conflict situation in having it resolved within the institution. All these shouts, I'm going to complain. In the end, it will just end with some kind of formal replies, and you won't get anything out of it. But for the institution, it's a big headache if, God forbid, it actually goes somewhere, especially if it ends up in court. If there's a conflict situation, believe me, the person most interested in keeping it at the department or clinic level is the head of the structural division. Visit the head's office or clinic, where even the chief doctor might be present, and communicate with them respectfully without making threats. Management dislikes being threatened and may react defiantly, advising you to take legal action. Instead, approach them cordially, expressing that you comprehend the situation but have not been admitted or hospitalized due to a misunderstanding between you and the doctor. I did it this way, it just didn't work out. Put yourself in our position. Believe me, we will always meet you halfway if you treat us like people. We're not just doctors, we're people first. So we will always meet you halfway. Listen and help. And that's why, if there is any kind of conflict situation, resolve it at the institution level. The worst thing is that I don't understand when someone tries to resolve some kind of conflict situation. Rospotrebnadzor gets involved through complaints, writes something, and sends it to the same institution. The person then gets hospitalized. He gets admitted to an ecological inpatient facility for surgery, the same place where numerous complaints were filed, and he doesn't understand why. Another point, the point is called all doctors are people. They know how to take offense. They know how sometimes not to do nasty things, but to use the fact that they will do everything strictly by the letter of the law. They will do everything as required. So let's say not the way he came to something after years of practice, optimize something here, serves here, that's how it will be. So for example, there, he saw 2 leukocytes in your urine. He says, you can't be admitted. Go take antibiotics. You take antibiotics for 2 weeks. You come back to show your test. It's still not sterile. You have to take more. I can't do that. In principle, he could have ignored this and admitted the person despite the person having a stone and walking around with a tube. But here it's about principle. Someone wrote a complaint about him and he says, so that's how it is. And he nitpicks about things he could basically turn a blind eye to. He doesn't break the law, he actually follows it super strictly, but he torments the patient. And there are plenty of stories like that. That's why you shouldn't file a complaint against the doctor where you'll be coming for treatment. That's also one of the pieces of advice.
Is it true that if you get in through some acquaintance, by recommendation, or with some kind of gift or something else, you can get much better service, treatment, and so on? Like many people from the older generations are convinced that there's no other way to get an appointment.
Everything should be the same for everyone. I believe that what distinguishes a good doctor from a bad one is not just the level of knowledge, manual skills, or whether they can cure or not, but first and foremost, their humanity and attitude. And your attitude, I'm probably addressing my colleagues here, towards your patient should not be based on things like what they're wearing, what kind of watch they have, or what kind of phone they use. That's the nature of the job. You can actually make good money and drive nice cars in this profession, honestly. Our country offers excellent conditions for this, but to achieve it, you must work honestly, properly, and well to build your reputation. People will come to you and willingly pay in the private sector. If you have chosen a public healthcare career to serve society, you should not engage in extortion or expect rewards from patients who want to express gratitude. In our Russia, remember there was this free patient and paid patient thing. Well, it shouldn't be like that. If your level of gratitude or promises to the doctor can somehow affect how well, how correctly, quickly, and efficiently your surgery will be done, run from that doctor. That's not a real doctor. You should stay away from such a doctor. Point 11. Everyone is strong in something. For example, even though my department deals with basically all of oncology, I don't do percutaneous surgery or treat urolithiasis. I don't do it and I don't want to do it. I focus on surgery, meaning I actually operate. But often, what I encounter is that someone comes to see some big-name specialist, and then some important person comes in too, maybe a well-known official or an artist. And now he needs to be operated on, so they want someone to suggest that this particular specialist should do the surgery, that it should be me. And instead of honestly saying, my friend, I don't do this kind of work, my colleague does it, go to him. Or they handle this at that facility across the street, go there. Everyone tries to keep this important patient for themselves, nothing good ever comes of it. Of course, you can perform a surgery if you have basic surgical skills, even one you've never done before. But that's good, because a good surgeon is one who operates. Performing this surgery only once a year won't yield good results, as there's often little difference in skill.
People often ask, specialists may work at various clinics on different days with varying appointment prices. How do you know which one of them you should go to see him at?
The one where it's cheaper. Yeah, what's the difference? He'll give you qualified help. It's the same everywhere. I walk here. If you go to my website, though, you'll see that oncology is free, no waiting in line. That's it, please. What's the issue? People who book appointments with me for anti-aging, biohacking, or other topics do pay. But do you believe I treat paying clients well while treating others here poorly? No, there's really no difference at all. Everyone gets the same treatment. Attitude. Sasha, you can't do your job poorly just because you're paid less. But if that's the case, then you're a bastard. Point 13, don't tell the doctors. Sasha won't let me lie. What did you tell me about getting a second opinion? Or like, a doctor came to see me and I said, I have no problem with a second opinion. Well, if the patient wants to go, if you want to get another consultation somewhere else. By the way, I recommended that. Just some advice. When seeing a top specialist, avoid mentioning that you plan to seek a second opinion elsewhere. Never say you've already visited someone else and have come here. All these big, cool specialists, they like it when people practically worship them. If you come in and say you consulted elsewhere, like in Germany or Israel, with a colleague, and ask if I know a good specialist but decided to double check, that's all. there won't be a proper consultation. It will be the kind of consultation that will make you never want to have surgery with him in your life, and you won't get what you came for. Really, for a second opinion, and sometimes it can even end in a scandal, it can be a very unpleasant conversation. When you come, don't say that you came after someone else, and don't say that you do it quietly, say thank you, and if there's going to be surgery, then only with you. When you have an appointment, have a private consultation, and don't mention to them that someone else consulted with you. One more piece of advice, a point that comes out of this review. At times, results from histology or ultrasound come back unexpected. Patients may ask, did they find a stone in me? And he says, but you don't have any stones in your kidneys? What should you do? You probably need to go to another place, have it re-examined, double check. The main mistake is like when in court they bring the decision of the first instance and they say, look, how can we overturn the decision of the first instance? And they just write the same thing all over again. Well, you know, they're not fools there, so why would they write the histology differently? Well, we'll write it as it is, pretty much the same. What I recommend is to send the discs for review, send the histology for review, get an ultrasound done somewhere. Don't say anything or come with some kind of treatment. Don't say that you showed it somewhere else. Do not provide any hints or targets about a diagnosis, even if clearly written. If asked, say you lost the information or don't have the description. Let them evaluate the situation as independently as possible without having any hints. Believe me, this is only in your best interest. It's not a life hack, it's more like a joke, a piece of advice. Everyone says that there is no blacklist of patients. Don't think that if you come to some institution and then leave, slamming the door loudly, and spoiled your relationship with the whole staff, do you really think that other colleagues won't find out about you? There are a lot of different communities, clubs, WhatsApp groups where, frankly, people who have behaved badly are marked, so to speak. For example, when we get a patient who, for some reason, was being treated, and then suddenly stopped, and who can't explain why he suddenly changed his doctor, or something like that. We practically all know each other. With just one phone call in the same city, it's easy, and we always know what's going on there. After someone comes in, because it's considered ethically correct, if you operate on someone after another doctor, you should call that doctor. And that's why you shouldn't think that if you've ruined your relationship with your surgeon or behaved badly, that the next doctor you go to won't find out about it. The new doctor is expected to get in touch, as not doing so is considered improper. That's how our surgical community works. If a patient is operated on by someone and later goes elsewhere, it's always like that. So, by design, it's customary to call and say, hello, Sasha, what's up, how is it, why? And vice versa, that's also considered the right thing to do. Or even if someone comes for a consultation, like for a second opinion, we are always in favor of continuity. So they blacklist as if it doesn't really exist, but in reality it does. So there is a kind of closed circle of patients that you can end up in, and the whole city will find out that you are behaving very badly. There are some really bad people out there. I hope you're not one of them. Point 15. Even at a reputable institution with a good specialist, you might be someone's first surgery if you came in off the street. In the series of who will operate, that's who will operate. Sometimes you are someone's surgery. Because surgeons, they always learn on someone. They learn on someone and they perform certain stages. Either the entire surgery is done by a resident, a young doctor, also on live patients, meaning they know how to operate. That's why you sign a consent form when you are actually being hospitalized. That means this student also, let's say, has access to the body during the procedure, but you shouldn't think that he will be the one operating while the professor goes off to have tea. No, not together like that, but some stage or even a part of the operation can be entrusted to an assistant and you will be training a person. At some point, this is called residency. A person can't just theoretically learn everything with us, then get a diploma, become a specialist, get a certificate, and start working independently right away. No, it doesn't work like that, so sometimes you end up being someone's first operation. You need to remember this, especially if you're going to an institution with something complicated, something that's not simple. My main advice, based on this last point, is to go to a specific specialist and ask for that particular person to perform the operation. If you don't ask, you might be operated on by someone who just wants to learn the surgery, not necessarily the most skilled surgeon, especially in a busy hospital.
You open the website, there are lots and lots of doctors, you choose by specialty and so on. There are these ratings. Can you actually rely on them or not?
Listen, well, for some you can, for example, like with doctors, what's good about it is that you basically can't leave a review there. If you don't attach the report, like the discharge summary, that you were treated, and that's why you can't just go in and write something nasty. When would you actually leave a review? Either when you're super satisfied. That's why reviews are always either a 1 or a 5. It's especially important to remember that oncology patients are people with traumatized psyches, and of course we treat them with understanding. A patient arrives causing a scene by swearing and hissing. He's offended and upset with everything. Living there, he can't fathom why he can't be cured. We treat many things well, but not everything. And when such a patient, it's really a cry of pain, like, how can this be? Why me? Why me? I'm young, we understand. Some patients behave rudely, which is unrelated to their oncology treatment and more about their character.
There's another question as a follow-up. There, for example, they choose which specialists to contact. How important are years of experience and academic degrees for a job?
An academic degree shows that you know how to work with scientific material, that you're a researcher, that you can write articles, that you can draw some conclusions and work with statistics. But at the same time, you might have last seen a scalpel in your life 20 years ago in a textbook. When you come to a professor is an academic degree, it's not a qualification. A person can be a good surgeon without being a professor, or vice versa. Ideally, a surgeon would also be a professor while operating. That's a really cool combination, which is my main point. All these instructions can be used in various ways. It's crucial to recognize that genuine doctors are always on your side, and their primary objective is to help you achieve good health. He's not an enemy, he's not someone who is trying to deceive you or just do his job because he's forced to. A real doctor is someone for whom this is a calling. He gets satisfaction from it, and for him there is no greater reward than doing his job well. For me, the main criterion when choosing an employee is that they should be a good person. I think you can learn to do a lot of things with your hands, you can read a lot, but if by your nature you are not a very good person, you won't be able to truly heal. Few people believe in this, and few people attach any significance to it, probably, but for me it is very important. If your doctor possesses this kindness, it radiates from within and is evident. And those are the kind of doctors you should be treated by. By kind, good doctors who are drawn to you. So, friends, find your own doctor, let him give you health, and you will be grateful to him and love him. Have a good day, everyone.